Imagine a world where pain is the only anesthesia, where blood is the answer to almost every ailment, where medical knowledge is a dangerous mixture of superstition, tradition, and a rudimentary understanding of the human body. This isn't the plot of a dystopian horror movie. This was the reality of medicine in the Middle Ages. And if you think you are prepared for a trip back in time to face a common cold or a toothache from that era, think again. In truth, you would never, ever survive medieval medical treatment. To understand why, we must first dive into the medieval mind. The foundation of all medicine was the theory of the four humors, an idea dating back to ancient Greece. The body was seen as a closed system containing four vital fluids: blood, phlegm, yellow bile, and black bile. Each of these humors was linked to an element, a season of the year, and even a temperament. To be healthy, these humors needed to be in perfect balance. Any illness, from headaches to fevers, was a sign of imbalance. And the most common way to restore this balance? Yes, you guessed it, removing one of the excess humors. And what was the easiest humor to remove? Blood, of course. Bloodletting. Bloodletting was the panacea of the Middle Ages, the universal solution for everything. Did you have a fever? Bloodletting. A headache? Bloodletting. Pneumonia? Bloodletting. Indigestion? Bloodletting. Even the bubonic plague was treated with bloodletting. Medieval doctors, or whatever passed for a doctor at the time, firmly believed that bad or excess blood was the culprit behind almost every infirmity. The methods were as varied as they were brutal. The most common form was phlebotomy, where a cut was made into a vein, usually in the arm, and the patient was left bleeding into a bowl until they felt weak enough, or until they passed out. The amount of blood removed was frightening, often more than the body could handle without severe consequences. It wasn't uncommon for already debilitated patients to die of hypovolemic shock after a bloodletting session. And who performed these procedures? Often barbers. Yes, the same men who cut hair and shaved beards were the ones wielding the sharp, dirty lancets. If direct phlebotomy wasn't enough, there were leeches. These worms were applied directly to the patient's skin, where they would latch on and suck the blood. Although leeches have limited medical applications today, in the Middle Ages they were used indiscriminately, without any control over hygiene or volume. Can you imagine the terror of having dozens of leeches feeding on your body while the barber surgeon waits for them to resolve your swamp fever? But bloodletting was just the tip of the iceberg. If a tumor or swelling appeared, the solution was cauterization. Red-hot irons were applied directly to the skin or tissue to burn out the disease, seal wounds, or stop hemorrhages. The pain was unimaginable, and the risk of subsequent infection was sky-high. In a world without effective painkillers or antiseptics, cauterization was a torment that many did not survive. If you were lucky, you would pass out from the pain. If not, you would feel every fiber of your body being charred. And what about a persistent headache or behavior that today we would call a mental disorder? In the Middle Ages, this could be attributed to evil spirits or excessive pressure inside the skull. The solution? Trepanation. Yes, we are talking about drilling a hole into a living person's skull. With rustic tools such as hand drills and saws, a medieval surgeon would bore a hole in your skull to release the demons or the bad blood. The long-term survival rate was minimal, and even those who survived were left with severe after-effects, not to mention the almost guaranteed risk of brain infection. Imagine waking up from surgery with a hole in your skull, with no painkillers, and the open wound exposed to the filthy environment of the time. It is a nightmare that defies imagination. More complex surgeries were even more terrifying. Appendicitis, for example, would be a slow and painful death sentence. A compound fracture almost always resulted in amputation. And what were amputations like? First, there was no anesthesia as we know it. Perhaps a little alcohol or opium, but the pain would be excruciating. The surgeon, usually the barber surgeon, needed to be incredibly fast. With dirty, unsterilized saws and knives, he would cut through flesh, muscle, and bone in a matter of minutes while you were held down by several assistants. Afterward, the wound would be cauterized with a hot iron to stop the bleeding, or covered with poultices of herbs, spider webs, or even animal feces, which were believed to have healing properties. Infection was practically guaranteed, and gangrene was an inevitable conclusion for most. But it wasn't just surgery that was a nightmare. Hygiene was an unknown concept. Germ theory would only be discovered centuries later. Doctors didn't wash their hands between patients, surgical instruments were reused without any sterilization, and hospital environments, which were more like shelters for the sick and dying, were hotbeds of contamination. People died of simple infections that today would be treated with a course of antibiotics. A small scratch could turn into fatal sepsis in a matter of days. And common illnesses, like the flu and colds, were treated with rest. But if symptoms persisted, bloodletting came back into play. And for skin diseases, ointments based on lead, mercury, or arsenic were applied, often causing more harm than good, slowly poisoning the patients. Yes, poisons were considered medicines. Medieval dentistry was a chapter apart in the Book of Horrors. If you had a toothache, the only solution was extraction. No anesthesia, no asepsis. A blacksmith or barber would use thick pliers to yank the tooth out, often breaking the jaw in the process. Resulting infections were common, and again, could lead to death. Oral hygiene was almost non-existent, so cavities and abscesses were a constant. The idea of preventing dental problems was unthinkable. And maternity? Childbirth was one of the most dangerous experiences for a medieval woman. Without modern knowledge of hygiene and anatomy, midwives and the few doctors who attended women faced extremely high maternal and infant mortality rates. Complications that would be easily resolved today, like a baby in the wrong position or postpartum hemorrhage, were frequently fatal. The life of a woman and her child depended almost entirely on luck and the body's endurance. If the mother survived the birth, there was still the risk of puerperal infections, which constantly claimed young lives. Beyond the brutal procedures, oral and topical remedies were equally bizarre and ineffective, if not dangerous. Urine was used as an antiseptic for wounds and even drunk for certain ailments. Animal feces were applied as poultices. Potions were prepared with ingredients like mummy powder. Yes, Egyptian mummies were ground up and sold as medicine. Unicorn horns, actually narwhals, and a multitude of herbs mixed with superstition and magic. Many of these remedies were inert, others toxic. Reliance on astrology to determine the best time for bloodletting or to harvest herbs was common. The alignment of the planets was just as important as the patient's symptoms. And when the Black Death swept through Europe in the 14th century, medieval medicine was exposed in all its futility. The doctors, or those who remained, were completely lost. They tried bloodletting, cauterization, vinegar baths, magic amulets, air purification with aromatic herbs, and even religious flagellation. None of these measures had any real effect against the Yersinia pestis bacterium. Death was omnipresent, and the impotence of medicine in the face of an epidemic of this magnitude is a somber testament to its limitations. The plague doctors, with their bird beaks full of aromatic herbs, were figures more symbolic of despair than of any hope for a cure. The truth is that medieval medicine was a battlefield against ignorance, superstition, and a lack of resources. There were no microscopes to see germs, nor an understanding of human physiology beyond what could be observed with the naked eye, or deduced from ancient texts, which were often misunderstood. Religion and mysticism frequently overrode what could be considered a scientific approach. So the next time you have a headache and grab a painkiller, or go to the dentist for a filling, take a moment to be grateful. Grateful to live in an era where pain is not a diagnostic tool, where hygiene is a basic principle, and where science and research have advanced to the point of making most medieval diseases mere footnotes in medical history. You would not survive medieval medical treatment. And frankly, none of us would. It is a grim and bizarre reminder of how far we have come. If you are fascinated by this terrifying journey into the past of medicine and want to discover more bizarre facts from the Middle Ages, don't forget to leave a like Subscribe to the channel and hit the bell so you don't miss the next deep dives into the strangest corners of history.